And now we're live. Happy Sunday, everyone. TikTok Live number 67. We're up to 67 now. About to do a solid 30 minutes. It's June 22nd, Sunday. Guys, the top 5 listeners that stay on the live for the longest time. TikTok shows me the analytics in the back. So whoever stays, the top 5 that stay on the longest of the TikTok Live, I'll be giving you guys a shout out in the caption of the YouTube, the podcast, everywhere. All right. So let's get after it. So Brown Sugar asked, how much you gonna make past residency, post-residency? Gang, been following you a while now. I know you got that big money now. VEO? What's VEO? No, I don't have that big money now. Maybe one day, but I don't know. Big money you're not going to make being a doctor or a surgeon or an oral surgeon. Oral surgery is generally the top of earners in dentistry. That's excluding business owners, though. Business owners who own 20-something offices and they're taking a percentage of different places, whether it be the real estate, whether it be associates working for them. That's probably big money because now you're getting into entrepreneurship. But when you're a doctor, you're a surgeon, you're a dentist. Unless you have that, you're making a good salary. Don't get me wrong, but that salary is right around what it was 20, 30, 40, 50 years ago in some areas, and the quality of life has changed over time. Right, but big money, I mean, 6 figures in the main cities of the United States, New York, LA, 6 figures is now middle to low income. That there was a study that came out this weekend showing that. So it's kind of concerning to see the direction of where everything's going in. But all right, let's continue. Elon Musk just got the #1 gifter badge. That's funny. HSN1234. All right, the TikTok Live's jumping around my chat again here. Is your job dentistry? It's oral surgery, yeah, within dentistry. It's the specialty of oral maxillofacial surgery within dentistry, yeah. Ryan said, what cases do you guys work on with plastics? With plastics, we did a lot of cases of whether it be fibula flaps, essentially where we take a portion of the jaw out, right? Whether it be cancer, whether it be osteomyelitis, whether it be some other issue that caused the bone to degrade, maybe get infected, maybe, cancers. Take that out, and then plastic surgery takes a fibula out of the leg and then reconstructs the defect area with that bone, the meat around it, vessels. They have to anastomose in the area to make sure blood supply is getting to the flap, the meat and the bone going in that area because you want it to survive, right? Potentially be used as a scaffolding in the future for implants, perhaps. So there's a lot going on in these, and those are the ones we combine with either plastic surgery or ENT. Other ones we do are pectoralis flaps, we got scapula flaps, we got radial forearm free flaps. So there's a bunch of flaps that we do. All right, let's see. Next one is M Fountain 75. Where are you going to practice? I'll be in Melville at All County Oral Surgeries. Dr. Chapman's got several offices. I'll be at the one in Melville, so on Long Island. That's Suffolk County. It's right on Route 110 of Long Island. So I'll be there starting in August. Daniella joined. What's up, Daniella? User 5573 said, congrats on finishing residency. Thanks, friend. Yeah, we're moving along here. Nafisa joined. What's up, Nafisa? HSM12345. What does it mean that if the tooth from the outside is turning slightly blue? Well, that could be a few things. What is it? Doxycycline could potentially cause bluing of, or tetracycline is probably the more common one, causing bluing of the teeth, changing the color of the teeth. But that's if you take it when you're pregnant, or kids take it when they're young. It could potentially happen. Otherwise, when they turn blue outside, actually, it reminds me of that Viking Harald Bluetooth, one of the Viking kings of Denmark. But the Bluetooth logo is actually made after Harald Bluetooth, one of the Viking kings, by the way, if you didn't know that. Fun fact. But anyway, so it could be a number of things. You could get darkening of the tooth. Maybe it got avulsed, it came back out and you reimplanted it, got a root canal on it. Sometimes, teeth change colors after they have root canals because the vitality of the tooth is now different. That can cause it too. Purple OC said, chat, question mark, can we not get 10K likes? Everyone double tap on your screen, please and thank you. That's nice of you, Purple OC. Gunna's right testicle asked, what was your CBSE score? I got what I needed. To graduate. It's funny because the CBSE is like, I feel like you always want better. You always want more. And that's a good thing. But, sometimes you do, if you run out of tries to take it, then you have to take what you can get. You know what I mean? But, I got what I needed. I had 14 or 15 interviews and I got accepted to my #1 ranked school. So everything went well. But, just try your hardest to do on the CBSE. User 1222 said, have a 72 on the CBSE applying this upcoming cycle. Nice. Is it an okay score? taking it again, but that's my base. Yeah, that's a good score. That's a very good score. And the CBSE scores have changed several times over the years. But yeah, that's a strong score. And cool, you're taking it again, so we'll see what you get. Kev, osteonecrosis, you also do that? Yes, we did a lot of osteonecrosis. We did a lot of what we call scoops, where there's osteonecrosis in the mandible or the maxilla, and what we do is we get out there and clean out all the dead bone. We send out the sequestrums. We send out the sequestrums for labs. We want to pathology to analyze them or to send out to see what the cultures grow, as far as if pathology can identify any cultures, whether it be aerobic, anaerobic, fungal, even. Yeah, we've seen that. So we do that a lot. User 1222 said, go to Penn Dental, 4 externships, 1 publication, getting nervous. ASF around now. Yeah, it's going to be nerve-wracking, but you go to UPenn, so excellent. 4 externships is great. You got a publication in. I'm assuming you're going to be applying more towards, you're looking at 6-year programs. You're going to be just fine, man. Just if everything else is looking good in your resume, you have your rank is in the right place, you have good letters of recommendation, you're going to be just fine, all right? Husai said nerve damage. Have you ever done wisdom teeth extraction with nerve damage? Dot is asking, have you ever done wisdom teeth extractions? Yeah, I've done a lot of wisdom teeth extraction. I lost count of how many wisdom teeth I've extracted. Husai said nerve damage, so I guess that's separate. I guess that's a separate question. But yeah, have I ever done extractions with nerve damage? I mean, there was twice, because one of my attendings liked this lingual flap. Not a lingual flap, but would like to reflect on the lingual of the mandible of some of the mandibular third molar extraction sites. And I'm not a fan of that. I don't like digging the periosteal down, even if it is on the bone all the way down. There were 2 instances where that led to lingual nerve paresthesia, not damage, but paresthesia. Okay, so maybe a slight injury, and both of them came back over time. But I don't like to do that. So, and since I stopped doing that, I haven't seen it at all. So yeah, I don't like to reflect a lingual, getting under the lingual flap on a third molar site at all, because it could result in lingual nerve damage. User 56395, how to know if you have periimplantitis at an implant site? Well, is there purulence? Is there pus? Is there mobility? On the x-ray, does it show that you have some threads? Clinically, do you have threads exposed? On x-ray, do you have the bone below any threads? Is it at the crest of the implant? There's so many things that go into it. So how to know? Those are some things to look at. All right, and ask your dental provider about. Kev said trauma sometimes. Wait, Kev, what did you ask? Trauma sometimes? Yeah, we do trauma. Always remember, God asked, what is the cheapest pathway to get a maxillofacial residency in America or Europe or foreigner? Cheapest pathway? It would not be in America, okay? That's probably at the bottom of your list. The cheapest pathway would be probably through a foreign institution, foreign country, but I don't know what the process would be of getting there, and I don't know how many years it'll take. I don't know what scores you need. It might be more competitive. I don't know. It might be less competitive. Who knows? PK said, what is one tip that you would give someone in undergrad wanting to go to dental school? One tip I would give is really hone in on that efficient and effective studying. Effective studying is getting higher grades, CEB A's, but then maintaining those A's, but studying for it less and less. That's efficient studying. I found that out with Quizlet. I kept through undergrad. I kept writing everything out. When you get to dental school, at some point you realize, like, you don't have time to write everything out if you're at a very academically challenging dental school. So I switched over to Quizlet. I got a lot more studying in a less amount of time, and it all worked for me. My grades went up over time, so that was better. Treya said, in my first year and have lower class rank and are still interested in an OMFS, what do you recommend? I recommend going for it. Go for it. See what you can do. Keep working on those grades, okay? Effective and efficient studying. Maybe try out Quizlet if you haven't tried it yet. Anki's another good one a lot of people use. Check out those different ones, okay? That's going to be important for you. And always go for it. And even if you don't end up in oral surgery, there are other specialties to do. You could be a GP dentist taking certain courses that might get you closer to that oral surgery procedure realm, right? Always remember, I answered that one. OC said, after going through OMFS and getting the MD, can you specialize in other fields like general surgery? I mean, technically you could then apply. Once you get your MD, you can apply to residencies. There was a guy at our program, actually, the year before I started, I externed with this chief resident, but he graduated the year right before, like a month before I started. And he tried to go anesthesia from oral surgery. So he got his MD, and then he ranked them. And the program director actually told him, no, you can't do that. You got to finish our program. So he didn't go through with it. But yeah, he tried to go anesthesia from our residency pathway. How about that? Richard Newen said, lingual? Lingual what? What's up, Richard? Lingual what? dat._.le. Why do you assume 6 year because of the publication? 4 years, not care as much? No, look, I'm not saying that they don't care as much, but only one or two of my 14, 15 interviews, most of them were 4 years, two of them were 6 years. Two programs did ask me about my research, but about 7 or 8 of my interviews asked me about playing the violin. And the 6-year residencies didn't ask me about my research. But generally, it's a more academic. Publications are good, especially when you're applying to 6-year residencies that have an emphasis on research and publications and such. Okay, so that's something to consider. But yeah, that's why I assumed the 6-year. Not really much of anything else. And I'm not saying that 4 years don't care as much. Just from my interview pathway, my interview cycle, I didn't get many interviews on research in general at all. And what was it? 12 out of 14 or 13 out of 15 of my interviews were 4-year interviews. Just my damage, you think? Have you ever had to reconstruct the face after a gunshot wound to the face? Actually, I didn't get. We've had to reconstruct the face after a poor guy fell off scaffolding a couple floors up and just his face was smushed, just lacerations everywhere. His upper lip going this way, his lower lip going this way, his nose going over to the side. Just a mush of maxillary fractures. I don't think he had a mandibular fracture though. I don't think he did, actually, believe it or not. So he used the mandible as the foundation and then built, placed the occlusion on top of that with the maxilla, got everything in line, arch bars, and then placed fractures up from there. We started with the bottom up. This is over a year ago, so I might be, no, I think I remember that. User 5639, what is your favorite and least favorite? No, my AnnetteMcbee asked, are you located in New York? Yes, I'm in Smithtown. That's Long Island, New York, but I just came from Manhattan where I graduated residency. And we're back on live and recording the TikTok live number 67. Already about 15, 20, about 15 minutes in, and the recording just stopped in the background. So I just restarted it. All right, let's get back to it. Friends. Shreya said, do OMF residencies care about upward trending grades? I mean, it looks good. It definitely helps. You know what I mean? There's other ways around it. Maybe you get a good CBSE score. That's what I would emphasize working on is getting that CBSE score to make up for any deficiencies. Letters of recommendation could help. The school you're coming from can help. Let's see. And Dot just asked, have you ever had to reconstruct a face after gunshot wound to the face? So my response to that was that it wasn't a gunshot wound. One of the bigger ones that we had, I mean, there's always, unfortunately, people get pushed or fall into the subway and get hit by the subway, and that breaks a lot of bones that I saw through residency. But the one in particular, I remember for a little over a year ago now, poor gentleman was on scaffolding. He was doing construction work in Manhattan, fell on the scaffolding a couple floors high. It hit his face, had lacerations everywhere. His upper lip was going up to the side. His nose was going to the side. His lower lip was going down to the side. Didn't fracture his mandible, thankfully, and we were able to use that as the foundation to reconstructing the face from those points. So we got him into occlusion from there, locked him down, arch bars, top and bottom, locked him down into MMF, and then reconstructed the maxilla from there. He had a ZMC fracture on one side. Floor fracture was fixed. Put a plate there. Put a plate on the lateral orbit, and then the ZM suture as well. Yeah, so that was pretty good. Random user said, I'm a perio resident. I'm clueless on how much I can expect at first 1 to 3 years out. How much I can expect to make? Oh, you're asking me an idea? I don't know. I start working in August. I just graduated OMFS residency, but I don't know what you've been making in perio. I don't know your location. The location of where you practice determines a lot of how much you can charge. Are you going to be predominantly insurance-based? Are you going to be fee-for-service? That has a lot to do with it. Okay. Big Mound. By the way, guys, top 5 listeners, one more time to TikTok Live. Top 5 listeners who stay on the longest. I'm going to give you guys a shout out in the caption of the podcast and YouTube. Big Mound said, do you pass fail dental students have better odds of matching it to more competitive residencies? It depends on the school. It depends on what their CBSE score is and the rest of their application. But from what I've seen, I mean, Stony Brook is not pass fail, but they're not ranked. Pass fail is Harvard and Columbia, I think, right? Is UPenn? I don't remember. But all those schools have great match. Generally, year after year, they have good match rates into residency. So that's something to consider, all right? DAT_.le said, thoughts on importance of rec letter compared to other parts of application, CBC or externships. Yeah, you got to have good letters of recommendation. All right, when you're spending time with these faculty members at your dental school, at oral surgeons in the OR, on journal club meeting, a lot of these things. Yeah, these are very important. CBSE is probably going to be number one across the board because it kind of levels the playing field. It kind of gives them an assessment that they compare you to other applicants. After that, GPA and rank is important. Letters of recommendation, externships. It's kind of hard because these can be ranked, by priority based on program director. Michael Payne said, you got that Porsche yet? No, I don't have a Porsche yet. I don't think I'm ever going to get a Porsche, to be completely honest. I'm going to start with the Cybertruck. I saw the Cyber SUV. I don't know if that was real or that was just a chat GPT. He take more than one surgeon. Does who take more than one? Does who take more than one surgeon? I'm sorry, I missed that. Michael Painfall, the live creator. What's up, Mike? Thank you. 39 said, have you ever ran a cardiac arrest in a patient on the ICU? Yeah, I had to pick up a patient from the neuro ICU, from neuro ICU. It was on the top floor. I had to bring them down, and they were on over 10 drips to manage their blood pressure and certain hemodynamics and such. Like, there were more than 7. There were more 7 drips hooked up to this person. We had to get 2 people transporting. We had respiratory therapy, pump in the bag. I was part of one of the residents, the ICU residents, in terms of managing this patient. And they literally had a cardiac arrest. We had him hooked up to the EKG, the monitor, and it like slowly started to wean off in the elevator. We rushed him back to the room. And yeah, that's all I want to say about that right now. Mike the Bike 1231. If you didn't do OMFS specialty, what would you choose, or would you just stick to general? Yeah, probably just stick to general. Although the perio residency at the VA is extremely advantageous. Now, many of these VA perio residencies, they want to take, from what I've seen, they take applicants coming out of a GPR, so it turns into 4 years, and then at that point, you might as well just do a 4-year residency. But the reason I suggest perio at a VA program is because at the VA, many things, if the veterans are service connected 100%, they get everything paid for. You having the experience of implants, there's no to you where you want to, if you want to place an implant because this is the best restorative option here, and here, or 10 implants because that's the best restorative option for them, you can do that. At every other institution, you cannot do that because finances are the issue. So the VA is a very big thing. And when you're in perio, you're at the VA every day. When I'm in oral surgery residency, I was only at the VA maybe 9 to 10 months over 4 years, and they were a great 9 to 10 months. I got more than 21 full arches in. I got 3 zygomatic implants, 3 or 4 IPS systems placed, zygomatics, the whole 9 yards, and 153 single implants I ended up with, or I forget, whatever it was. But it was a great residency experience that I got. Very thankful to Dr. Orentlicker. He was my attending there that really got the ball rolling with that. And then Dr. Temkin and Dr. Sletic. Brown Pocky said, I read a story where a boy passed away from dental anesthesia. It was crazy. Yeah. I just had a podcast with Dr. Mark Leffler. He's an oral surgeon and now malpractice attorney. We just chatted last week, and he said there's 6 cases this year of deaths associated with dental anesthesia, and they were all general dentists or pediatric dentists. So that's interesting. Yeah, getting like week-long courses and certifications for IV sedation after just a week of training. Not great. I don't know how it's so loose in some of these states, but it really should just be oral surgeons and dental anesthesiologists doing any IV sedation. Just my thoughts. Kabera said, in dental school, what extracurriculars did you have on your residency applications? I did do research with Dr. Georges Romanos at Stony Brook. Shout out Dr. Romanos. I got to get Dr. Romanos a anesthesia presentation, by the way. Okay. Santa Cruz Medicinal said the dental Owen Hunt. There we go. Nice. That's really funny. That's really hilarious. Lyric. Also in residency, I was a part of ASDA. In dental school, I was a part of ASDA. I really like to be a part of ASDA. I was the treasurer of the class, treasurer of ASDA. Yeah, there was a couple things that I did throughout residency, and I would try and go on trips and externships. Those are big for oral surgery. Alexia McCaughlin said, would you do it over again? I don't know. Let's see how working is first. Let's see how working is. I start in August, and then I'll be able to give you a really fair assessment after a year or two. That would make sense, right? Kim said, hey, retired perio hygienist from the Mile High City. Oh, in Colorado. Nice. What's up, Kim? How we doing? Sped said, have you heard anything about military OS residencies? Yeah, I've heard they're pretty tough. I heard there, but all oral surgery. Actually, I can't say that. Not all oral residencies are as tough anymore. I've seen that too. Michael Payne had a peds patient die in OKC under an anesthesiologist. Wow, Mike, that's scary. Lee Yerk said, do you know anything about the match rates out of Puerto Rico? Yeah, I think we got the match rates from Puerto Rico. Guys, look on predentmentormap.org. I'm pretty sure we got the Puerto Rico match stats of this year. From 2025 graduating dental students at Puerto Rico, I'm pretty sure we got the match stats for them. We have about half of them on Predent Mentor app now. I'm working on those. We're working on Loma Linda right now, and we're working on, who did I just put up today? LSU. So we're working on those, getting those stats. If anyone could help with any stats of dental schools in the United States right now, or Canada, because we have Canada on the map too, that would be very, very, very helpful. Bag 525. Do you think you're qualified to be a Bible teacher? Good question. I don't know. I would try and break down the teachings as best as I could. I like the Bible and I like the readings and the teachings from it, the lessons. But Mike the Bike 1231. If you didn't have any reasons to stay in New York, where would you practice if money was your number one priority? Well, money is not my number one priority, because the highest offer I heard was about 800 out of Wisconsin and Green Bay. The second highest was 750. And these are base salaries. I'm more interested in a percentage. That's because the percentage is, you get a percent of everything you do. Remember, these big organizations are trying to cap you on salaries because you're just coming in and working for them, but they're going to work you maybe extra hours here and there, more days, more responsibilities, but they're going to keep you fixed at that salary. You see what I'm saying? So you want to get on a percentage scale as quickly as you can. You got to understand, that's got to be your goal. Okay, First Down Dental. Okay, Mike the Bike. Okay, Vivian. Good. But where would I go? I mean, Wisconsin was a very high one. Alabama was offering 650. Florida, the highest I saw was 750, but that looked to be extremely rare. They were trying to get someone in that office. That was a nice opportunity for that chief resident that I knew last year. Those were the highest offers I've seen, throughout the country. It would not be in California. It would not be in New York, Massachusetts, Northeast. Not really, unless you're all the way upstate in the middle of nowhere, or Vermont all the way up, New Hampshire all the way up. So First Town Dental running for national legislative liaison. Nice. Vivian Newen said, what school did you go to? I went to Stony Brook Dental School, and then I went to NYU and Bellevue for my oral surgery residency. Vivian said, any advice for DAT studying? Yeah, you should just be studying right now. It's a lot of studying. I think Quizlet would have plenty of material for you on the DAT, and then DAT Bootcamp, DAT Booster, Crack the DAT, Crack the DAT Pat, Chad's videos, all excellent stuff. Alan, I want to go into dental, but my hand trembles when I hold it out due to prior injuries. Is that an issue? Is that your strong hand or your weak hand? And have you tried physical therapy? There might be those issues, but is the quality of your work affected by your hand tremor, right? And then there's also propranolol that could help with essential tremor. You could potentially take medications to help control that. Just some thoughts. First Down Dental said to Vivian Newen, you're going to crush it. Good luck, Vivian. You will crush it. Just keep studying. Make sure you're getting enough nutrition, your diet, your meals are on point, you're sleeping enough. Michael Payne, what's the ballpark for an OMFS that's owning their office? Yeah, owning the office, it's a lot more. You're making between 45 and 55%, maybe even higher in some situations, percent collections, because your office staff is going to take anywhere between 40 to 60% of your earnings in order to keep the office open. Yeah, but for the business owner, I don't really know, Mike. I don't. That's a great question. I don't have the exact answer to that. I really don't know. I want to find out. You know what I mean? JFC, JDB, does performance on the DAT correlate with any of the CBSE performance? No, I don't think so. I mean, I guess you could just say if you're a good test taker, that will correlate. I would agree with that, but generally not. This is Vivian Newen said, thank you. You got it, Vivian. How's everything going? How's the studying going? What undergrad school are you at? User 1013 said, what's going to be your approach for paying back loans? Well, loans or other forms of debt, or I'm trying to buy the house I grew up in, my childhood house. I want to get a Cybertruck because that would be a very safe method of transportation to and from the office every day. And it's going to be making a payment on those and then paying it over time, until it's all paid off. But trying to make bigger payments up front than waiting down the road. That's my goal. Okay. And as an oral surgeon, I should be able to do that hopefully fairly often. And between that and also, so on other things too. AnnetteMcbee said, do you work for yourself? My side companies and LLCs, yes. But in the practice that I start in August, no, I'm going to be working for Dr. Ross Chafkin. He's the owner of the multi-practice at All County Oral Surgery. JFC, JDB, would you mind sharing your CBSE score? That score, I know a lot of people are judgmental on, which is like, not now. Maybe one day. Just do the best that you can, okay? As long as you get around that 70 range, 70 or higher is generally safer, okay? I know plenty of people that didn't match that got above that. So it's going to depend on other things of your application as well. And just because you get under 70 doesn't mean you can't match either, okay? You can have a very good shot if you have a strong application otherwise, okay? PK said, how many dental schools do people usually apply to? I've heard so many things. I applied to 6. I only applied to 6 dental schools. I got interviews at 5 out of those 6. The one I didn't get an interview at was Florida because I'm not a Florida resident. Maybe that they do like 90 something in state. And then the other ones were Rutgers, NYU, Buffalo, Stony Brook, and Toro. Tony said, do you plan on talking about your salary as a surgeon practicing now? Probably not. I don't know. Should I? How transparent can you be? Because I know now from TikTok, a lot of these comments, they judge people that agree. So I don't know how much of the nitty gritty I can get into with that. There's only so much judgment that you can take in a space where, maybe it's your fault for giving too much information. I don't know. That's something I got to think about. That's a great question. Have you heard of any stories of pre-dental students applying, studying, and attempting the CBSE before gap year or during the gap year before dental school? No, I haven't heard anyone hitting a home run like that, doing that strategy. I don't know. Muhammad said, Doc, how would you flap a broken lower premolar for an extraction? Well, I'd have to see it in order to be able to. I'd have to see that, man. I'd really have to see that. A broken down lower premolar, I might not even flap that. It really depends on how broken it down it is, where's it broken down, depends on how much gingiva is left, what's the bone height. Yeah. Or just sticking a spade in there and wedging it in the previous PDL space and making room for it and then popping it out that way. Tony, because you talked about your residency salary. Yeah, but residency salary is like, that's a good question, Tony. And I want to be as transparent and talk about as much information as I can to give people an understanding. I'm probably going to be talking more in terms of like what it costs to take out a tooth, what taxes are like, how much money goes towards other things. It's a great question, but I don't know. I'm just going to get judged beyond belief. And I think that's very inappropriate, especially when you want to incentivize people to become doctors, dentists, lawyers, jobs that directly help and work on other people and their health. I think we should financially incentivize that for a good quality of life, not just about the money, but for a good quality of life. And the quality of life is not necessarily getting any better in the healthcare space or residency, or maybe a little bit in residency, some residencies, some of those that obey the GME laws. But JFCJD, do you think it would be worth a shot CBSE during gap, assuming 4 to 6 months of study? No, I don't. I don't think that, because you're not going to be absorbing those things until you kind of saw it maybe a little bit in dental school. I don't think it'll be worthwhile. You're just going to forget everything once you start D1 year. I don't think it's worth it. I think it's worth taking the time to travel, spend time with friends, family, party, do what you got to do. Do those things, travel a little bit, see part of the world that you never saw before in your gap year. That's what you want to be doing. M said stethoscope where? What do you mean? What do you mean? Tony said, I'm not asking, just curious. Yeah, no, I know you're just curious. I'm trying to think this out too, for my own understanding, for like, should I talk about salaries then? I don't know. I gotta think about that. I gotta figure out what the answer is to that. Because Tony, that's something I've been kind of playing with in my head. Like, what should I do? Because I want to be as helpful and as transparent as possible, but I also don't want to be shunned to the point beyond belief, right? So yeah, it's something I'll think about. JFCJD said, thank you for your advice, Doc. Much appreciated. Yeah, you got it. Guys, by the way, top 5 listeners of the TikTok Live. I'm going to be giving you guys a shout out in the caption. Tony said, wouldn't recommend it because people will probably ask questions about it nonstop. Yeah, exactly. I might talk about it in terms of what we bill out, and then what we actually collect, and then what the insurance is actually like, how much is our fee for extracting teeth, putting in implants, whatever it may be, and then what certain insurances pay for those extractions. That could be beneficial, right? And then how much we make for that, and how much maybe we made in a day or week or month, that might be beneficial. But what do you think, right? Yeah, like breaking it down per tooth, per what the IV sedation, what we get reimbursed for that. That might be a better way of doing it. I want to make sure that it's easy to digest, but it's got to be applicable. But I don't want to step on any toes. You know what I mean? I know you get that, Tony. Chocola de Melion said, do you have any tips for starting dental school starting next month? Yeah. Try, yes, the effective and efficient studying. Try to figure out a way that allows you to keep high scores, the effective studying, but then efficient too, where you can study less and maintain the high GPA, high scores. You know what I mean? Study less and less. You're going to need that in dental school, because undergrad is an equivalent of about like 15 to 20 credits. Dental school, as they say, is an average of 32 credits a semester. So you're going to need to learn how to study for a lot of different things, which means studying less and less for each one, but you want to maintain those high scores. Okay. So in Quizlet, using the premium version, make Quizlets, use figures, use ChatGPT to make questions, question answer, and put a figure, a clinical photo, x-ray, or whatever you need on every slide. Okay. Tony said, because I'll show you how much doctors make based off how much insurance pays. Yeah, exactly. It will show how much doctors make based off of how much insurance pays. Exactly. The discrepancy between what we charge for surgery and what insurance actually reimburses. Someone was telling me last week we charge $600 per extraction at our oral surgeon office, right? We're oral surgeons taking out teeth. It's going to be more, we're trained to take out teeth with years of experience in that. It's going to be more than a general dentist in many situations, right? But in reimbursement from insurance of someone, there's only like $100, $125 per tooth, but we charge $600. And the patient's kind of responsible to pay that out of pocket, that in between, whatever insurance doesn't. But do they? That's where the discrepancy between production and collections back is different, okay? How much all-nighters did you pull on residency? Oh, God, Mike, I don't want to think about that. too many nights. Too many nights. I don't like it. There's a time when you're on the night shift, so you're literally you're doing all nighters because you like, right? And then you take a little nap in the day, but your body's saying it's noon, it's 1 o'clock, I got to get up, and you just got home at 8 a.m. Yeah, those are definitely an experience, and I do not want to ever do those again. Got to maximize the day from. That's another thing. I got to work on getting up earlier right now, which means getting to bed earlier and maximizing my mornings. That's going to be key for this next chapter right now. It's always good to kind of audit yourself and get your check in place for your nighttime wind down routine. Make sure you relax and can recollect the day, but then also you get up early enough and maximize the day from that standpoint. I do a lot of work, like 1 to 2 hours of work before I go in. I do a 10-minute ab workout. I do other posts and stuff before I head in. So that's a lot of stuff that I got to get out of the way before I go into work. Cali Girl 73, what's up? She said, get your results yet? Nope, we still haven't got our results. How about that? Cali Girl 73 said, Mike the Bike, 1, 2, 3, 1. We watched him in real time. Yeah, you did. Chocolat de Melion, I'm from the Netherlands. It's kind of different here. Thank you so much. Yeah, you got it. It's definitely, it's unusual, right? It's definitely different. Ellie Irk said, what do hours look like as an associate in private practice? The practice I joined at is 9 to 5. I want to work 8 to 5 Monday through Friday. No weekends, and I signed a contract where I'm at one office. There are other options. Other offices will do 8 to 6 Monday through Friday and 8 to 2 on Saturdays, taking call in hospitals, having hospital days for your hospital procedures. Yeah, so that's what I'm looking at. All right, guys, time to sign off. I got to get going. Got to eat dinner, get ready for tomorrow. I got to be in the office at 8. We're doing some software training. I don't know. It's 8:15 now, June 22nd. TikTok Live number 67. Top 5 listeners. I'm giving you guys a shout out in the caption of the podcast and YouTube. So thanks for coming on. All right, guys. Love you guys. My podcast family.